All right, think about this for a second. From the flick of a wrist to a powerful kick, every single movement you make is possible because of some seriously incredible biological engineering. Today, we're unlocking the blueprint of motion, our joints. So let's get started.
Have you ever really stopped to think about it? How exactly can you kick a football or sign your name or even just glance over your shoulder? These actions feel so simple, but they rely on this really sophisticated system working perfectly together. So what's the secret? Well, the secret, of course, is our joints. They're the connection points between our bones that allow for this amazing range of motion. Today, we're going to break down this whole biological blueprint into a super clear, simple revision guide for you.
Okay, first things first, not all joints are created equal. We're going to start by classifying them into 3 distinct types, and it's all based on a spectrum of movement, from none at all to complete freedom. When it comes to classifying joints, it really just boils down to one simple question. How much do they move? That's it, that's the key. So let's look at the first type, which, well, allows for no movement whatsoever. So on one end of the spectrum, we have fibrous joints. You'll also hear them called fixed or immovable joints, and honestly, the name says it all. No movement happens here. Their job isn't motion, it's all about protection. The perfect example is the joints between the plates of your cranium, your skull, which fuse together to form a solid helmet for your brain. Right in the middle of our spectrum, we find cartilaginous joints. Now, these are your slightly movable joints. They allow for just a little bit of give, which is absolutely crucial for things like absorbing shock and giving us limited flexibility. The classic example? The joints between the vertebrae in your spine, which let you bend and twist.
And now for the main event, synovial joints. These are the freely movable joints, and they're the ones we usually think of. They allow for the biggest range of motion and are responsible for pretty much all our major body movements, like what you see in the knee, the elbow, and the shoulder. Okay, let's pull all that together. This slide right here is your key revision summary. You can see the 3 types, fibrous, cartilaginous, and synovial, all lined up with their other names, how much they move, and a clear example for each. This is the table you want to lock into your memory. So, since synovial joints are basically the superstars of movement, we're going to zoom right in and see what makes them tick. Let's really dissect the anatomy of a synovial joint. Here we go. This is a typical synovial joint. In this case, it's the knee. Now, it might look a little complex, but don't worry, we're going to break it down into 5 key parts, one by one. Let's start on the outside with the ligaments. If you look closely, you can see these tough, kind of elastic bands. Their whole job is to connect bone to bone. They act like these really strong straps to give the joint stability and stop it from moving in the wrong direction. Now, look at the very ends of the bones. See that smooth, whitish coating? That's cartilage. Think of it as the body's natural, non-stick coating, but with built-in cushioning. It's the joint's shock absorber, making sure the bones just glide smoothly over each other instead of grinding together. Ouch! Okay, wrapping around the entire joint is the joint capsule. This is a tough, fibrous sleeve that basically holds everything together. It provides structure, it provides stability. Think of it as the container for all the important bits and pieces inside. So lining the inside of that capsule is the synovial membrane. This is a really, really important structure because its one and only job is to produce a special fluid that keeps the whole joint healthy and moving freely. And that special fluid is this, synovial fluid. Honestly, you can just think of it as the engine oil for your joints. It lubricates everything, reducing friction to almost 0, and it also delivers vital nutrients to the cartilage. Pretty clever, right? So we know the types of joints and all the parts of a synovial joint. Now, let's learn the specific language we use to describe all the incredible movements they allow. It's like a whole new vocabulary. First up, we've got the most common pair, flexion and extension. Flexion is just decreasing the angle at a joint. In other words, bending it. Extension is the exact opposite. You're increasing the angle or straightening it. Go on, try it now with your elbow. Bend it, that's flexion. Straighten it, that's extension. Simple. Next up, abduction and adduction. A good way to remember this is that abduct means to take away. So abduction is moving a limb away from the midline of your body, like raising your arm out to the side. Adduction is adding it back towards your body. See? Abduct, take away. Adduct, add back.
Now let's talk about the ankle. When you pull your toes up towards your shin, that's called dorsiflexion. And the opposite, pointing your toes down like you're standing on your tiptoes or, I don't know, like a ballet dancer, that's plantar flexion. And finally, we have rotation. This is just a turning movement around a long axis. The easiest way to feel this is to just gently turn your head from side to side. That movement, that's rotation of the neck. Whew, okay, we've covered a lot of ground. So let's bring it all together into a final, super simple revision checklist to make sure you've got all the essentials locked down. Right. For your exam, you absolutely need to have these 3 things down pat. First, the 3 types of joints and how much they move. Second, the 5 key parts of a synovial joint and what they do. And third, you've got to be able to define and give an example of the key movement pairs. If you master these, you'll be all set. You know, the best way to make this all stick is to actually apply it. So head over to your Revise Direct member dashboard and download the joints labeling worksheet right now to test yourself. And I'll leave you with a final thought. What's the most complex athletic movement you can think of, and how many of these joint actions does it use all at once?